This morning in our Health Spotlight, we're talking Seasonal Affective Disorder, or SAD. Joining us today is Dr. Stewart. She's the Medical Director of Avance Psychiatry in Charlotte. And here we go. Let's start with the basic understanding, because most people don't know what SAD is. What is SAD?
So it's basically mood changes that have a seasonal component. We have two distinctive patterns. So we have a winter type, which is the most common, and a summer type. Usually we'll see symptoms that start around the fall and the winter time, and they improve with the spring and the summer. Those symptoms can vary from things like issues with sleep, so either sleeping too little or sleeping too much.
Does the holidays exacerbate that even more so?
It can, but SAD specifically is because of the seasonal changes, and so there are different components that are related to that, with the not having as much sunlight outside during the day.
So people who are triggered by SADs are triggered by not having the sunlight on them. Is that what we're talking about?
Yes, exactly. So there are different things that actually cause SAD. And so basically there are things that are melatonin, serotonin, and vitamin D. So when we're talking about the sun, we're talking about vitamin D. We're not getting as much vitamin D because we don't have as much sunlight during the day. That serotonin is a neurotransmitter that we have in our brain that's responsible for preventing us from becoming really depressed or overly anxious. And then the melatonin is something that is responsible for the sleep-wake cycle. So when the sun goes down, melatonin goes up. When the sun goes up, melatonin goes down. Melatonin causes us to feel really tired and feel sleepy, so that's why when it goes up at night, we feel tired. So when we don't have as much sunlight and we have more melatonin than we have at other times during the year, then we overall just tend to feel more sad and we feel more tired. And so the people who are more susceptible to that can feel that more strongly than others do.
Dr. Stewart, what treatments are available for people who are going through that?
So there are different treatments. So we can do psychotherapy, which is basically talk therapy, where you would go to someone, they can help you to process the feelings that are associated with that, help you with some behavioral strategies for you to implement in your day-to-day life. We can do medication treatment, so things like vitamin D supplementation. We can use antidepressants as well. And then we also have phototherapy, which is light therapy. So you would have a light box that you put in your home. You expose yourself to that for about 30 to 45 minutes each day. You can do that while you're brushing your teeth, getting yourself ready in the morning. We also want to make sure that we're opening up the windows and giving ourselves natural light, getting, a routine established, all of those things. Even with things that seem very simple, like a light box, I'd want to make sure that people are talking to their healthcare providers, because even something as simple as that, you can have medications that you're on that make you more sensitive to light, that wouldn't be a good idea for you, or even problems with your eyes. So you always want to make sure that you're talking to your doctor before you do anything.
So if you know that someone is suffering from SADs, what do I suggest? What's available for them? What should they do?
So if people are suffering from many of those symptoms that I discussed earlier, I'd want to make sure that they go to their healthcare provider, somebody that they're seeing regularly. If that person has long wait times, or if they don't have a regular provider, my team at Avance Psychiatry is available to see new patients fairly quickly, and we take most insurances, including Medicare.
And where are you guys located in Charlotte?
So we are located specifically at 5821 Fairview Road, Suite 200. That's in the South Park area of Charlotte.
And what's the website that people can go ahead and follow you?
AvancePsychiatry.com/Charlotte.
AvancePsychiatry.com/Charlotte.
Yes.
Dr. Stewart, thank you very much for being here.
Thank you so much.